Welcome to the 2020 Public Health Law Virtual Summit. We have two presentations in this session, and each individual presentation will be followed by its own Q&A. Use the chat feature to submit your question. If you encounter technical difficulties during the summit, go to the navigation menu and select the Need Help button. I will now turn it over to our first speaker.
Good afternoon, everyone. Thank you so much for joining me. I'll be speaking about health inequities, housing inequities, and how they're all exacerbated during this COVID-19 crisis that we're going through. So when I speak about housing inequities, I'll start with a historical overview before going into an action plan for us moving forward. I'll explain how health disparities related to housing are causing really kind of multiplied and layered issues that really have to be addressed. And when I speak about how these housing inequities are exacerbated, I've divided it into some categories. Public housing, will take a look at what the federal government is doing with respect to public housing residents and what's going on with rent assistance, mortgage forbearance in that context, and also for some private homeowners, what options might be available to them. And then we'll talk about the eviction moratorium. It's ever evolving. It just changed again this month. So I'll give an overview of what's going on there with respect to laws and policies and how it's really complicated given how the eviction process has several different steps. We'll talk about homelessness and people who are experiencing homelessness, how a lot of their health disparities are really, really troubled during these times. And finally, with respect to homes, we'll talk about utilities. So what options are people experiencing with respect to making sure that their utility service remains consistent. And of course, this is even more important because people are working from home more often. And this also includes broadband internet access, which is of paramount importance since a lot of children are being schooled at home. And so in moving forward, I'll talk about some solutions that should be enacted on the local, state, and federal level. And as our host, Anna, mentioned, please feel free to drop your questions in the chat. Definitely look forward to hearing from you. If you have questions about anything that I've said or anything that you think that we should be doing moving forward, I'd really like to discuss that as well. So starting with housing inequities, as I'm sure you all know, decades ago, the federal government issued maps which gave low ratings to Black neighborhoods, prohibiting many of these families from receiving government-backed home loans. And even after these practices were explicitly made illegal, these practices and also restrictive covenants were deemed unlawful. The federal government then built public housing for Black people, and these were in segregated areas. This is all in the backdrop of the Fair Housing Act. The Fair Housing Act was designed to create these truly integrated living patterns, but it continues to be lackluster in its proactive enforcement of mechanisms. And the current administration has stripped the act of regulations that would have given cities and states the tools to really evaluate their effectiveness in creating integrated living patterns. So fast forward to today, and we see we're more segregated than ever. The United States also only has enough affordable housing for 65% of people who need these types of affordable housing. This means that the other 35% must choose between basic needs and housing, or their option would be to face the consequences of experiencing homelessness, or they're living in these what I would call de facto affordable housing, which tends to be substandard structures with mold, allergens, and a lot of irritants that cause respiratory disease and other problems. And so all of these inequities are really, really troublesome, even before we're talking about the pandemic. In addition to physical illnesses, there are stress and mental health problems, nutritional deficiencies because of food insecurity, and a lot of these are also exacerbated due to gentrification processes. The rotation of white people fleeing neighborhoods as Black families move in, only then to reclaim those spaces during gentrification processes, this also has severe health consequences for Black families. And the displacement resulting from gentrification is really problematic because mobility is associated with even more physical and mental health issues. There's also a positive correlation between a lack of affordable housing and food insecurity. So faced with the choice between paying for housing or other expenditures, necessities such as healthy food and medicine are often foregone. And the effects of nutritional deficiency are especially felt in schools and school-age children. This creates a lot of issues with respect to academic achievement and really perpetuates the poverty cycle. And so all of this creates even more racial health inequities. It's also important to note, as I mentioned, as I go through some of the housing issues, that a lot of the workers that have high exposure rates to COVID-19 are living in low-income housing, substandard housing, or even experiencing homelessness. So this not only makes them more susceptible to being affected by COVID-19, but also making the health consequences of the illness even more severe for them. Okay, so we have passed the CARES Act in March of 2020, and as I discuss it in different buckets, I'll start with public housing going through to utilities, but the overall theme that you'll see as I speak at the federal level and then also include some state and local initiatives to address some of the housing crises is that they're really limited in time and in scope. So while the efforts are definitely notable, they really fall short, and I think as the virus continues past what anyone thought originally last spring, we'll see people affected on a really, really high level with respect to their housing and their health. So when the CARES Act was passed in March of 2020, it addressed several housing issues stemming from the coronavirus outbreak. But it's important to note that the beneficiaries of the CARES Act with respect to housing are people who rent or own homes financed with HUD or the FHA, or homes that are secured by a Freddie Mac or Fannie Mae mortgage for the most part. So even though a large percentage of financing for public housing is allocated by the federal government to states and come with broad guidelines, there's still an opportunity for local and state public housing to really get involved and to address some of these issues. So with respect to public housing, the CARES Act allocated an additional recently $685 million for public housing operations through the end of 2020. And the majority of these low-income housing units for public housing, is important to note that these are multifamily structures. So this is a high concentration of people in these buildings, which complicates social distancing. And the funds are related to rental assistance, and they're not to be used to help with any type of social distancing measures, and they're explicitly not to be used to improve the structural conditions of the housing. So a lot of the buildings that are older, they can't use the funds to take more preventative measures for these respiratory illnesses. There also are very few testing of residents and staff, even though there's ongoing eligibility requirements, which continue to require face-to-face interactions. With respect to mortgage forbearance and rent assistance, the federal government enacted a forbearance of residential mortgage loan payments for multifamily properties with these federally backed loans that I mentioned through the CARES Act. And the initial forbearance was up to 180 days with a 180 days extension for those people who are affected by the coronavirus. And fees and penalties were not to be assessed during this time. Rental assistance, we saw a lot of states getting creative with respect to having their legislatures issue funds to provide grants for rental assistance. For example, in Washington, there was an executive order prohibiting rent raises during the emergency period, but only 2 states did this. And there were just a handful of states that prevented late fees during this time. And most of these mortgage forbearances, rental assistance grants, they go through the end of the year. And here we are mid-September, still experiencing the effects of COVID-19. So it's doubtful that life will be back to normal and people will be able to pay all of their back payments to the extent they were affected by coronavirus for all of these months. Eviction moratoriums. They started off through the CARES Act. There was a moratorium on eviction provided for federally impacted properties until August 31st of 2020. And this prohibited the recovery of housing possession from the tenants due to non-payment of rent, including late fees. Something to note here is that eviction proceedings initiated prior to March 27th are not included by this federal law. So some states had to turn to state laws, to local laws in order to keep their homes. And a lot of states have refused to implement statewide eviction and housing stability orders, which means that landlords can charge late fees during this time, they can increase rent payments during this time, and utilities may be disconnected, or there may be utility reconnection fees. Since this order that just went through August 31st of this year, the CDC just on September 1st issued an order prohibiting evictions until the end of the year for renters who make less than $99,000 per year. So again, this is only until the end of the year, and something that's really important to note that we'll discuss in more detail is that the judicial response is varied from jurisdiction to jurisdiction. Eviction law and process is governed by rules at the local or judicial district level. So I live in Atlanta, Georgia. In Georgia, the court process depends on which one of the 159 counties you're in. So you can have a lot of disagreement among the counties with respect to what part of the eviction process is prohibited. Is it filings? Is it sending notices to quit? Can you collect late fees? And so it's very different, and tenants are unsure of where their rights land. Only 28 states restricted some part of the eviction process during the state of emergency. And this varies from suspending hearings to judgments of possession, and maybe some just have extended deadlines for tenants to respond. So people are still being evicted or still being threatened with eviction during this crisis, even though there's a moratorium. With respect to homelessness, a lot of states, a lot of localities have gotten creative and created temporary shelters for people who are experiencing homelessness, but we still see these numbers are growing because the eviction moratorium and other housing protections don't go as far as they need to go. So even though there are temporary shelters set up, it's still very difficult for people who are experiencing homeless to comply with CDC guidelines. And if our goal is to keep people safe and issue stay-at-home orders, that's very difficult when you don't have a home to go to, or you don't have a home beyond a small period of time. With respect to utilities, the really big things that are important here are service continuity. And if you're going to have to comply with CDC guidelines and safely shelter in place, this is really important. Also, given the fact that employment is of an issue and that people are really trying to save funds, having to pay connection and reconnection fees can be very detrimental to families. 27 states have prohibited utility companies from disconnecting services during the state of emergency, but only 7 states provided utility reconnection fees at no charge to the resident. So requiring tenants to pay hundreds of dollars will be a barrier to utility access to several low-income residents. And tenants remain at risk of losing electricity and water after these moratoriums expire. So when we think about solutions, again, focusing at the local and state and finally the federal level, there are situations that we really need to improve in order to increase the time frames for some of these protections. A lot of the people who are affected by COVID, as we've seen, are disproportionately Black citizens, brown citizens. These are the same population that are at higher risk of living in segregated areas and low income areas. So as all of these things are interrelated and exacerbated, it's important to understand how the policies have to affect these underlying social conditions to not just address the housing problem on its face, but to also help to eradicate some of these health disparities. So there are some things that local governments can do. Starting with how we're interpreting these emergency orders and how we're interpreting these declarations. We need to make sure that eviction is defined broadly and that all parts of the eviction process are halted. Government officials can also authorize the use of homeless assistance grant funds, which they received from the CARES Act, for safe, longer-term housing that address some of the underlying issues for why people are homeless, and also working with other nonprofits and mission-driven organizations to provide social services to people who are experiencing homelessness in these shelters. Our local housing authorities can also allocate funds to nonprofits to provide these social services. And there's a lot of other things that we can do to be more proactive against more people becoming homeless. In addition to completely stopping evictions, except for reasons of nonviolent or emergency reasons until after the state or local emergencies are over, plus a time period to allow for people to get back on their feet. We can extend payment periods, we can stop the collection of any late fees, and we can eliminate restrictions on individuals who are evicted from private housing from the Housing Choice Voucher Program. The Housing Choice Voucher Program prohibits a lot of people from receiving vouchers if they've been evicted, and we might see a raise of evictions due to this coronavirus program. So we want to make sure people aren't having barriers to housing simply because of the pandemic. Local housing authorities also have authority to cease enforcement of any minimum rent during the pandemic for people who are living in public housings, and then we can again give a period of time for 6 months after. So we really want to focus on ongoing and comprehensive release so that these aren't just short-term solutions, and we see a flood of people experiencing health and housing problems a short time after the pandemic is over or the emergency declaration runs out. With respect to the state level, state legislatures have really broad powers to appropriate funds and to enact laws. So they can use their powers to subsidize high-speed broadband internet for residents. They can provide alternative housing. They can use vacant buildings, hotels, shelters to provide housing for people who are experiencing homelessness. And also, they really need to get creative with how we measure some of these ongoing eligibility requirements for our public housing units. We can have grants disseminated in order to encourage technology to collect information from residents, to reduce some of the face-to-face interactions, and also to provide testing on site for public housing residents and their staff. State legislatures can also appropriate funds to provide rental assistance to low-income renters and also to landlords to reduce the incidences of evictions at all levels of the eviction process. And all of these rules should really be clarified at the state level so that there's not this different judicial interpretation from county to county as to what's allowed and what's not too allowed. State legislatures can start by clarifying what good cause eviction is and really limiting the reasons for people being evicted during this pandemic. So we can limit good cause evictions to incidents that threaten the life or well-being of any tenant in the building or a violent crime. And we should explicitly remove from good cause eviction the non-payment of rent during the pandemic and for a period of 6 months at least after the pandemic. And again, providing utility and broadband internet subsidization is really important for our children who are learning from home, people who are working from home. It's really important that education is uninterrupted. That's inextricably linked to housing as well. And moving forward at the federal level, funding has been allocated. We have seen that the virus has gone on longer than anyone thought and longer than Congress, I think, believed when the funds were provided. So there should definitely be an increase in funding, and I think that has been pending for a while. So moving forward with increasing all of the funding related to the pandemic, especially in the housing context, is of paramount importance. We can also amend the Affordable Housing Credit Improvement Act of 2019, and what this will do, this will increase the tax credit allocations to provide more affordable housing. Low-income housing tax credits are the biggest provider of affordable housing by far, and in order to create and maintain a healthy supply of affordable housing so that more than 65% of people are not paying more than 30% of their income towards housing, will really help to stave off homelessness. And also Section 8 of the U.S. Housing Act of 1937, that can really address who's eligible for housing choice vouchers. We can increase this to 300% of the poverty line instead of only having people who make, families of 3 who make $25,000 a year being eligible for housing choice voucher programs. We can also allow for nonviolent, formerly incarcerated individuals to be eligible for housing choice voucher programs. Again, looking at the criminal justice system and the high rates of coronavirus, COVID-19 that has been rampant in these areas, it's important that safe and affordable housing for these individuals is available as well. For the CARES Act, extending the time limit on the eviction and foreclosure moratoriums for homeowners and for people with single-family mortgages especially would be extremely helpful. Providing loan forgiveness for 3 months for owners of multifamily properties with federally backed loans is within the power of Congress through the CARES Act. And finally, $4 billion was allocated for homeless assistance grants, and this should be able to be used for emergency solution grants for permanent supportive housing for people experiencing homelessness. Permanent supportive housing really addresses the underlying reasons for why people are homeless. In addition to providing a shelter, we can provide them with substance abuse training and treatment. We can provide them with job training and really address all of the underlying issues to make sure that people remain safely housed. I definitely look forward to speaking with you more about these policy initiatives and what your thoughts are on what has been enacted and what we should do moving forward. You can read, again, more on our assessing legal responses to COVID-19 and our playbook. I definitely encourage you to download the entire playbook or any individual chapters at the link provided. And you can reach me if you have any other questions or comments beyond this session. Thank you.
Thank you. We will now move to the question and answer, and we do have our first question. Please continue to enter questions in the Pathable chat section. Who has more power to issue and enforce rental assistance and tenant protection policies? California has seen a variety of state and local policy, as well as working to follow the CDC guidance.
That's a great question. When you mean who, I assume you mean local, state, or federal government level. If that's right, the localities receive their funding, from states and the federal, but the local governments are really on the ground with respect to more immediate housing assistance. And so the funds have been allocated, and with respect to how these housing operations can be put into place, they can move more quickly and I think be more effective at the local level. So once the funding has come in, then the localities are responsible for running public housing. At a broad level, if you're talking about kind of increasing overall the affordable housing supply, that's more of a tax credit allocation from the federal government. But right now, just responding to this crisis for rental assistance, as you mentioned, the state and local governments really have a lot of leeway there. Thank you.
Thank you. As we wait for more questions to come in, do you have any additional comments? Or Sharon, would you like to comment on the presentation?
One other thing I can say quickly while we're waiting is just that I'm glad everyone's here and just understanding, we talked about the connection here between housing and health, but again, between housing and education and the criminal justice system, a lot of these things are interrelated. So one solution can go far to help a family or an individual in a lot of these instances.
Yeah, and I was just going to ask Courtney, is there a jurisdiction that in your mind kind of represents best practice in terms of responding to this crisis and protecting folks with housing issues?
The person who asked the question before mentioned California. They've done quite a bit. Also, the state of Washington has done quite a bit with respect to grants and rental assistance. So those states were really kind of on the forefront of realizing that the assistance needs to go beyond, a lot of states did like a 30-day or 60-day. They were the first ones to say there's not a time limit. It's when it's going to be tied to when the emergency is over. So that's something that I thought was important.
Great, thank you. If there are no more questions, we can move on to the second presentation.
Great. Hi, everyone. I'm Sharon Turman. I direct the Work and Family Program at Legal Aid at Work, and I'm really happy to be here with everyone today talking about these important issues. I'm going to be speaking today about protecting workers' jobs and income during the COVID-19 crisis. And as we all know, these past 6 months have been extraordinarily difficult for millions of Americans who are experiencing personal and family health crises, caregiving crises, massive unemployment crisis, not to mention racial justice and climate crises, all at the same time. And I think the pandemic has really highlighted how vital it is to have a functional social safety net to help workers and their families stay afloat financially, stay healthy, and care for one another. And two key components of such a safety net are job-protected paid leave from work and unemployment assistance. So first, just a little bit of background about Legal Aid at Work. We are a nonprofit legal advocacy organization based in California. We were founded in 1916, and we advance the workplace rights of workers with low wages and their families. We focus on a wide range of issues facing low-wage workers, and we engage in outreach and education, litigation, direct legal services via a number of clinics and helplines, as well as policy advocacy. And our work is directly informed by the experiences of the thousands of low-wage workers who contact us each year. And of course, we've seen a significant increase in the demand for our services with the coronavirus crisis. Just in the last 6 months alone, we've served over 5,000 workers struggling to maintain their economic security during the pandemic. So an overview, I'm first going to talk about the minimal job and income protection policies that existed before the pandemic. Then I will describe the key policy responses that we've seen in these areas since the pandemic hit, including the Families First Coronavirus Response Act and the CARES Act. And finally, I will assess the remaining gaps and barriers and offer some policy recommendations to better support working families during the pandemic and beyond. So in terms of the job and income protection policies before the pandemic, so we know that from a wealth of research that paid leave has tremendous benefits for families' health, well-being, and economic security. But before the pandemic, the US stood nearly alone in the world in having no federal paid leave policy at all. And a lot of people are surprised about this, but there was not a single right to a single paid sick day if a worker himself or herself got sick, or if their family got sick, much less time to bond with a new child, to care for someone who's seriously ill, or to deal with one's own serious illness. The lack of paid leave is, of course, especially harmful to workers with low wages who rely on every single paycheck to make ends meet, and therefore are more likely to go to work sick for fear of losing the income they need to support their families. This chart shows just the horrible situation that existed pre-COVID-19 in terms of paid sick days. It's from the World Policy Analysis Center. So, of course, we did have, since 1993, we've had in the United States the Federal Family and Medical Leave Act, which provides unpaid but job-protected leave to workers who need leave due to their own serious illness, to bond with a new child, or to care for a limited number of family members who are seriously ill. But we also know that the FMLA excludes over 40% of the workforce and disproportionately excludes low-wage workers and workers of color based on the very strict eligibility requirements to the law, which require that you work for a large employer, that you work a certain number of hours in the prior year, and that you have been on the same job for at least a year. We also know that low-wage workers and workers of color are less likely to have employer-provided paid leave, which leaves them facing an even more significant crisis if family illness or personal illness strikes. There are a number of states and localities that have passed paid sick days and paid family leave laws over the last decade or so, or 15 years, 20 years, I would say. But low-wage workers face, nonetheless, significant barriers to accessing these policies. There are administrative and language barriers, inadequate investment by government agencies in outreach and education so that folks actually know that they have these rights, which often they're paying for. In California, for example, it's entirely worker funded. But we've seen through surveys that many workers don't even know that this right is available to them. And that's been true in other states as well. We've also seen barriers, language barriers. So sometimes the application form for these policies is not translated into folks' own language. So there are a number of barriers that existed prior to COVID-19, which, as I'll talk about, have been exacerbated by this crisis. And then turning to unemployment benefits. Since the 1930s, the unemployment insurance system has provided temporary partial wage replacement to people who are unemployed or underemployed through no fault of their own. To be eligible, claimants must be able and available to work. They must have sufficient earnings in their base period, which is typically a 1-year period prior to becoming unemployed. And they must have a valid work authorization during their base period and at the time of application, which has impacts on immigrant workers. So the gaps and barriers regarding unemployment benefits that existed prior to COVID-19, as I noted, you have to have valid work authorization. And so undocumented workers are categorically excluded under the unemployment insurance system. And other folks in the workforce are also excluded. New entrants to the workforce are excluded based on not having had sufficient prior earnings. Those who are self-employed have been excluded prior to this crisis. Secondly, the benefits are way too low. So we know that the benefits vary by jurisdiction, but the most generous jurisdictions cover only half of a worker's wages. And lastly, there are significant barriers just relating to systems in unemployment agencies. They're really antiquated systems, very confusing forms that people often don't understand and inadvertently end up misfilling out, and so they lose out on benefits or have to go through lengthy appeals before they see any benefits that they're entitled to. And again, I mentioned language barriers, which also apply in the unemployment system. So what have we seen in terms of the response to this pandemic in terms of job protection and wage replacement? The first law that I want to talk about is the Families First Coronavirus Response Act, the FFCRA, which was passed in March of this year. And this actually represents, as I noted, the first ever national paid leave policy. Of course, it has a lot of limitations that I'll talk about, one of which is that it only covers employers with fewer than 500 employees, and it's temporary. It expires at the end of this year. What it does is it provides paid leave for two main reasons. The first is it provides 2 weeks of paid sick leave if a worker is subject to quarantine or isolation order, advised by a healthcare provider to quarantine, is experiencing symptoms of COVID-19 and is seeking a diagnosis, is caring for someone else who is in quarantine or who's been advised to quarantine, or who is caring for a child whose school is closed or whose care is otherwise unavailable. In addition, it provides up to 12 weeks of emergency paid school closure leave. And for those 12 weeks, actually, only 10 of them have to be paid, but during the first 2, you can apply the 2 weeks of paid sick days under the FFCRA. In order to be eligible for the paid school closure leave, you need to have worked for 30 days, whereas the 2 weeks of paid sick leave is available immediately. And it's also on top of any additional paid leave that a worker might be entitled to under state or local law, which is great because sometimes some people who, when this crisis hit, may have already exhausted their existing leave. So in terms of the pay rate, If you yourself are ill or seeking diagnosis, the law allows you to receive 100% reimbursement or of your wages up to $511 a day. However, if you're caring for someone else, the pay rate is lower. It's 2/3 pay up to $200 a day. And there's also a grand total cap for both of those leaves as well. This is paid by the employer, but the employer can receive 100% reimbursement via refundable tax credits through the federal government. There were initially very significant exemptions written into the law. Actually, the way that the statute is written, it just allows healthcare providers and emergency responder employers to claim an exemption. There was a challenge by the New York Attorney General to the Department of Labor's interpretation of that exemption, because the Department of Labor originally interpreted that exemption extraordinarily broadly, so that essentially anyone who worked in any capacity for or who contracted with a healthcare related institution could be excluded from receiving leave. So, we're talking about someone who works at a cafe, at a medical clinic, a janitor, at a pharmaceutical company. Those folks and many more were allowed to be exempted. The challenge to the regulations by the New York Attorney General was successful, and the Southern District of New York issued a decision recently invalidating certain regulations as overbroad. And just this week, the Department of Labor actually issued revised regulations that, among other things, narrowed the scope of the healthcare provider and emergency responder exemption. So I think that's going to go a long way to covering more people, because initial estimates, when considering the exclusion of folks who work for larger employers over 500, in addition to the healthcare and emergency responder exemptions, among others, showed that over 100 million people were not guaranteed protections under this law. Finally, there's an exemption that businesses with fewer than 50 employees may claim if they assert basically that providing the leave would jeopardize the viability of their business as a going concern. And that is problematic because it doesn't require any real proof, just that and actually doesn't require an employer to provide any documentation to the Department of Labor. They just have to kind of document to themselves that providing the leave would jeopardize the viability of their business. Importantly, that exemption only applies to the school closure leave aspect of this law. So for paid sick leave, there is no small employer exemption. The major policy response in terms of unemployment benefits is the CARES Act, which expanded unemployment benefits in significant, albeit temporary ways. First, the Act created a new program called Pandemic Unemployment Assistance, which covers people who are not eligible for state unemployment insurance. So that includes those who are self-employed, independent contractors, as well as people without sufficient prior earnings. In addition to covering people who lose work due to COVID-19, Pandemic Unemployment Assistance also covers people who are sick or caring for others with COVID-19 and who can't work due to school closures. This program is set to expire at the end of the year. Second, a really important component of this law is the Pandemic Unemployment Compensation Program, which extended an extra $600 per week to anyone receiving unemployment benefits, including PUA. And that program ran beginning March 29th, but it ended at the end of July of this year. President Trump did allocate, as I'll talk about in a moment, FEMA funds to allow states to provide some additional monies for a limited time tacked on to unemployment benefits, but there's some limitations there as well. The CARES Act also provided an extra 13 weeks of benefits tacked on to the end of state unemployment insurance, which also expires at the end of the year. So as I mentioned, President Trump issued a presidential memorandum August 8th directing certain disaster relief funds to provide an extra $300 per week in lost wages assistance. However, the funds are capped, and for a number of reasons, this is not really an adequate replacement for pandemic unemployment assistance. We think that a number of states have not been able to yet disperse these funds, and it's likely only going to cover a few weeks. And if Congress is able to negotiate an extension to supplemental unemployment benefits, this program will cease to exist. In terms of other paid leave responses, we have seen a number of state and local jurisdictions enact paid sick leave laws that fill the gaps in the FFCRA or otherwise offer pay during quarantine. So there have been some innovative programs here. For example, in San Francisco, there's a program where workers are able to get just reimbursement, just funds to help them deal with lost wages during quarantine if they otherwise have trouble accessing paid leave through employers. We've also seen some state and local disaster relief funds or hardship payments created for undocumented workers who are excluded by unemployment benefits. In California, there was a $125 million disaster relief fund that provided one-time $500 grants up to $1,000 per household to undocumented workers. And it served 150,000 people. Oregon created a program that provided weekly hardship payments for a maximum of 4 weeks. But you can see that both of those models, are nowhere near sufficient to help undocumented workers who are experiencing a long-term crisis right now. And finally, some localities have passed right of recall laws that provide workers who are laid off in industries that were heavily impacted by COVID-19, like event centers and hotels, to return to their jobs once the employer reopens. So moving on to assessment and policy recommendations. We know that without paid sick leave, many workers simply feel they have no choice but to go to work sick. And so we know from experience this spreads infectious disease. During the H1N1 pandemic, the CDC estimated that 7 million people were infected and 1,500 died because sick employees didn't stay home. We also know that unemployment benefits are a lifeline for tens of millions of Americans who have lost their jobs due to COVID-19. A survey from May 2020 found that over 43% of adults said they or someone in their family had lost a job or income due to COVID-19, with disproportionate losses among low-wage workers and Latinx workers. And research has shown that the extra $600 from the pandemic unemployment compensation system has significantly lowered poverty rates for people of color. But there are major gaps in paid leave and unemployment benefits in terms of the federal policy responses, and these gaps and barriers disproportionately harm women and people of color. The FFCRA excludes millions of essential workers who are disproportionately people of color, immigrants, and women. It only provides full pay if you take the paid sick leave for your own health and not for caregiving, which harms women and women of color who do the bulk of caregiving. It only provides 2 weeks for your own or another's illness, even though we know that COVID-19, the disease can last for much longer. Working parents, especially women, are being especially harmed right now due to this ongoing crisis with children not being able to go in person to school. 12 weeks is simply not enough. A lot of folks already exhausted their 12 weeks before school started again. And there are also limits on the use of intermittent leave in the paid in the FFCRA that really make it difficult for folks to stay employed while helping their kids learn at home. And then we know that enforcement and outreach are not sufficient. People are having a really hard time understanding what rights they have, whether this law applies to them, how the law interacts with other policies that they may be entitled to. So there's a lot more work that needs to be done in terms of vigorous enforcement and outreach and education. On unemployment benefits, it is a major concern that the $600 additional supplemental benefits have been cut off, and we know that this is disproportionately going to harm women and Black and Latinx workers. There are significant administrative and language barriers. As I noted earlier, we've already had a system with antiquated systems, and that was complex and difficult to navigate. And then we've layered onto that system new policies that these agencies that are underfunded and understaffed are having a very difficult time implementing adequately. And we've heard horror stories of people who have waited and waited and waited and still have not received their benefits. And then again, the categorical exclusion of undocumented workers is a huge problem. So just to summarize, COVID-19 and the insufficient federal response are exacerbating inequities. The paid leave law is inadequate. It excludes millions of essential workers who are women, people of color, and immigrants earning low wages. The expanded unemployment benefits leave out undocumented workers, and key benefits have expired. And then the new COVID-19 related benefits, both in terms of paid leave and unemployment, are adding new layers of complexity and overwhelming agencies and outdated systems, creating substantial administrative barriers. So in terms of policy recommendations, on the federal level, Congress should pass the HEROES Act to eliminate the exemptions to paid leave in the FFCRA and provide comprehensive emergency paid sick leave and paid family and medical leave fully funded by the federal government. Congress should extend supplemental unemployment benefits for the duration of the pandemic and should extend unemployment benefits to undocumented workers. On the state level, states should create and fund wage replacement programs for undocumented workers who have lost work due to the pandemic. States should pass supplemental paid leave laws with funding and robust enforcement and outreach, especially in languages other than English, increase customer service staff and language access, simplify and translate forms in both unemployment and paid leave agencies. And finally, on the local level, localities should pass supplemental paid leave ordinances with local enforcement power and funding for outreach and education, pass right of recall ordinances to ensure workers are hired back to their prior positions, and should fund partnerships with public health departments and legal aid organizations to disseminate accessible information in workers' own languages about their workplace rights to both unemployment, wage replacement, paid leave, that could be disseminated at COVID-19 testing sites, through contact tracing, and via health clinics and hospitals. So with that, I'm happy to take some questions. And I think the first question from Nicole maybe is for both of us. I don't know, Courtney, if you want to take that one first.
I can read the question.
Okay, great.
I see a common theme in that the harms to people of color in housing and unemployment policies are not an accident. They result from long histories of purposefully excluding certain people from social programs or making their access more difficult. Could the speakers discuss what kinds of long-term changes can address these structural flaws?
Sure. Yeah, I definitely agree with your characterization of the theme. As far as structural changes to address these flaws, you're right. I mean, it goes beyond just like allocating, millions or even billions of dollars. It's really to address, to kind of rebuild a lot of these structures, from housing, not just housing, but kind of like even from like a criminal justice standpoint, employment standpoint. It's all just really, I mean, the entire country obviously is really built on, relies on a racist structure. So it really is a matter of reimagining and rethinking our entire society, which is a big task, but it's been done before. So I think starting from the housing system, starting with the value that everyone should have housing is kind of, until we get to that kind of basic foundational point, it's going to be hard to eradicate a lot of these inequities. Same thing with health. Until we recognize that everyone should have access to healthcare, then it's going to be hard to kind of eradicate any of these differences that you see among races or anywhere on the socioeconomic continuum.
Yeah, and I completely agree. I think with respect to employment and job protection and paid leave, I mean, it's really unconscionable that this country doesn't have a permanent paid leave safety net and unemployment safety net that's adequate to meet everyone's needs. So we really need, I think this is an opportunity, this crisis is an opportunity to rethink and to really center the experiences of marginalized communities in refashioning our policy. And, we need universal, comprehensive paid leave for everyone, for every single person in this country, regardless of who you work for, or how many employees or coworkers you have. I mean, these are universal life events that people experience, right? We all get sick at some point in our lives. We all have a family loved one who gets sick and will need to care for. And so our policy needs to be responsive to that reality, and we shouldn't have a piecemeal patchwork system where the privileged few who can navigate the system and who can speak the language and who have access to resources can get the benefits that they're entitled to, and that in many cases people pay for themselves out of their own paychecks. So we really need to take a hard look at this. And I think extending some of the benefits that we've started to respond to this crisis with is a first start, but we need to go way beyond that and work toward passing comprehensive, universal policies into the future.
As we wait for more questions to come in, is there anything else either one of you would like to add, Sharon or Courtney?
No, I just really appreciated this discussion and learning from you, Courtney, and also seeing the connections and the work that we need to do to kind of holistically address the crisis, the multiple crises that workers are facing right now. And I also am glad to see the opportunity that this crisis is presenting to do that work, and hopefully working together we can make progress in achieving these policy goals.
Yeah, I think that's definitely, if there is anything good, at least bringing awareness to these issues, since so many people are affected, although it still disproportionately impacts, some populations. Everyone can at least understand that this external force is just bringing to light some of the structural inequities that have always been present.
Well, thank you so much. That concludes today's session. Please press the button underneath this video feed in Pathable to take the evaluation for the session. Thank you all for attending, and have a great rest of your day.